Now, if there's one important lesson that Africa has hopefully learned from the COVID-19 pandemic, it is that the continent simply can't return to business as usual when the pandemic finally comes to an end. It must invest heavily in healthcare infrastructure across the continent. That's the key message from the African Development Bank, which is pushing to bridge the huge health infrastructure gap in the region. And to support this push, the ADB is making billions of dollars available to strengthen things like primary healthcare facilities, particularly in rural areas. It's also supporting the beefing up of intensive care units, laboratory capacity, and emergency medical systems.
I really think that it's time for us to build what I call an Africa quality health infrastructure defense system for Africa. Africa went through Ebola, Africa went through H5N1, Africa went through the HIV, and Africa is going through, like everybody else, with this coronavirus pandemic. But Africa does not have a real, in fact, it has a very, very weak, very poor health care infrastructure. So at the African Development Bank, we have started that conversation to help Africa to develop what I call this quality healthcare defense system, infrastructure healthcare defense system that it needs to have at the primary healthcare level, secondary and tertiary. At African Development Bank, we have launched a very bold facility of $10 billion to support African countries to address this coronavirus problem. That includes, by the way, $1.4 billion to support the private sector, because we must not forget the private sector. The small and medium-sized enterprises are very, very critical to keeping jobs going, and they form the largest part of the economy in Africa.
And that's the man who heads the African Development Bank there. Well, the man who's managing the African Development Bank's multi-billion-dollar response to COVID-19 in Africa, and who's in charge of the bank's strategy for quality healthcare infrastructure on the continent, is Dr. Babatunde Omilola, head of the Public Health Division of the ADB Group. And he joins me now in the studio. How nice to see you.
Thanks, Charles, for inviting me.
Thank you very much indeed for coming in. And just tell us more about the state of health infrastructure in Africa, which according to the World Health Organization is the worst in the world.
It's definitely the worst in the world. As we know it today, average bed density on the continent is around 1.3 for 1,000 people on the continent. When you look at the density in terms of health workers on the continent, skilled health workers, that's about 1.3 also to 1,000 population, which is very low compared to the WHO minimum target of 2.3. So in terms of annual output, Africa is losing $2.4 trillion on an annual basis as a result of ill health, which is huge. And despite the fact that the population of the continent is around 15% of the global population, we have a continent that is bearing about 24% of the global burden of disease around the world. And in fact, 50% of the global deaths as a result of communicable diseases happen here on the continent of in Africa. So basically, we have so many challenges in terms of health infrastructure. From our own analysis, we have seen that African governments are spending around $4.5 billion in health infrastructure every year. And what is needed from our analysis is $26 billion in health infrastructure space every year on the continent of Africa. So the challenge is huge, the needs are huge throughout the continent, depending on typology of African countries.
All right,
and that's why
thank you. I'm packing my bags up, moving somewhere else. No, but seriously, I mean, just based on those very depressing but factual figures that you just gave, I mean, that makes the continent hugely unprepared to cope with healthcare challenges such as a pandemic, doesn't it?
Correct. And that's why, as an African Development Bank, our board in April last year approved up to $10 billion COVID-19 crisis response facility to respond to this crisis in different African countries, first and foremost to provide liquidity for African governments to keep running, but also in terms of stabilizing African economies, protecting jobs, providing social protection coverage for the poor and the vulnerable in terms of social safety nets, but also helping small and medium enterprises as well as those in the informal sector throughout the continent. As a bank, we also launched a $3 billion COVID-19 social bond, which has been applauded globally as the largest dollar-denominated social bond in the international capital market as at that stage. And the bank has received so many awards for that because we realize that the challenges are huge, and as a bank, we have to come in. But of course, we cannot do it alone. We have to work with other partners, with other development organizations, but also with the private sector. And that's why we have crafted a strategy for quality health infrastructure in Africa.
Right. Well, I'm going to come to the private sector in the course of this discussion, but the problem is that the healthcare sector in Africa needs even the most basic facilities. I mean, that suggests that in terms of funding, inadequate funding, I mean, $10 billion is just a drop in the bucket. That's what you've budgeted for it. I mean, what figure would you place on the continent? Well, you actually mentioned that to some extent, on the continent's infrastructure needs in terms of healthcare.
Correct. Actually, for the $10 billion that the board approved, that was to respond to the pandemic.
Right, so that's specific.
That's specific for the pandemic.
Yeah, but
for an
obviously
emergency.
to fight the pandemic, you need infrastructure as well.
Exactly. And that's why our governors last year, in their communique after their annual meetings, in paragraph 5 of their communique, came up with the idea that as a bank, we need to articulate our strategic framework in health infrastructure going forward for Africa. And on that basis, we did an extensive, rigorous analysis. And we realized that the continent requires $26 billion in health infrastructure every year.
For how long?
For the next 10 years, until 2030, for us to really see big improvements in the sector. And what we currently have is $4.5 billion going into health infrastructure space.
That's from governments?
From governments.
African governments.
And also from other development partners. The total amount of resources going into health infrastructure is around $4.5 billion. But what is needed, it's actually $26 billion.
Right.
But let me give you some staggering statistics, because this will be very useful and it put us in proper context. Now, I've been in Nigeria for the last 1 week discussing with the Minister of Health of Nigeria, the Nigerian Sovereign Investment Authority, and many other partners in the country. And then we realized that according to the National Primary Health Agency of Nigeria, Nigeria officially has 25,000 primary health care facilities, but many of them, only 20% of them are functioning because of lack of accessibility, because also of lack of utilization, but also because they are not functioning, because they are not connected to water, to sanitation, to electricity, to transport, to communication services. And that's why we are coming in as an African Development Bank to see how we can support many of our countries on the continent in terms of revamping and revitalizing not only the primary healthcare facilities, but also secondary and tertiary health facilities, diagnostics infrastructure, and digital health, telemedicine, and making sure we have the connectivity. And of course, we cannot do it alone. And that's why we want to get more partners to come on board, fellow multilateral development banks. And that's why we have been engaging with the World Bank, with the Islamic Development Bank here in Nigeria. So the challenges are huge. More importantly, you find that on average, around 30% of Africa's population live at least 2 hours away from the nearest health facility to them. So accessibility is critical, and that's why we're into this business.
So which areas are key for immediate funding? I mean, you mentioned, some of those areas like, electricity and all the rest of them, because obviously you can't do it all at once, but you're obviously identifying key priority areas.
For us, we have identified 3 mutually reinforcing strategic pillars in health infrastructure. The first is primary healthcare facilities. And as I said earlier on, especially for the underprivileged people, the less privileged, the marginalized, the poor, those in poor rural communities, but also those in our low-income countries, especially in terms of connectivity to water, to sanitation, to transport, to communication services. The other is secondary and tertiary health facilities, especially focusing on specialty hospitals. You will realize that in Nigeria alone, in terms of outbound medical tourism, Nigeria is spending $1 billion.
Absolutely.
So if we can get some of these resources on the continent, in Nigeria and other parts of Africa, we will be able to do a lot. Now, also, diagnostics infrastructure is critical for us because when the pandemic hit badly last year, what we realized that only 2 laboratories were equipped to do testing, diagnostic testing.
In Nigeria?
All over Africa.
Wow.
All over Africa. And of course, this has increased tremendously. But then we realized that we also need to invest in diagnostics infrastructure, but also more importantly, digital health, telemedicine, and also how do we attract diaspora, to also invest in the sector. You will realize that in India, what they have done, they have supported their diaspora to come in and invest. They have given them all kinds of incentives, especially tax credits. And that's why 9 of the top 15 hospitals in India, as of today, they are based from diaspora investments in India. And that's the kind of thing we want to attract in Africa and in Nigeria as well.
Okay, well, stay with us. We're going to come back and talk some more with you. You're watching the Arise interview. Plenty more still ahead as we continue our chat with the head of the Public Health Division of the African Development Bank Group, Dr. Babatunde Omilola. Stay with us. Welcome back to the Arise interview. I'm Charles Aniagolu. Now, in the wake of the ravages of the pandemic, Africans are confronted with the stark reality of their continent's broken healthcare system. Africa's health infrastructure is the worst in the world, and for decades, no one paid much attention to it. Well, today, enter the African Development Bank with a timely warning that the continent cannot afford to go back to business as usual when the pandemic ends, and the bank is putting its money where its mouth is, stomping up billions of dollars to support the sector. But with corruption and years of neglect getting in the way of the AEB's plan to transform healthcare infrastructure in Africa, how far away is the dream of a robust healthcare system on the continent? And Dr. Babatunde Omilola, head of the Public Health Division of the African Development Bank, is still with me in the studio. Thank you for staying with us.
Thank you, Charles.
Do you look at all the countries in Africa and say, okay, this nation is in greater need and therefore it comes first?
Of course. We did a rigorous analysis to understand the disease burden and the health trajectory in different African countries, but also the health financing needs in different African countries, but also the health insurance needs in different African countries. We realized, for instance, that out-of-pocket expenditure in terms of our health expenditure on the continent is around 38% or so. For Nigeria, it's about 76%, which is huge. So we did all of this analysis. We look at communicable and non-communicable diseases across different countries of the continent, whether low-income countries, middle-income countries, countries experiencing fragility, or countries going through conflicts. And after all of that analysis, we came up with a strategy for quality health infrastructure in Africa. And that strategy, we are doing extensive consultations with ministers of health across the continent, but also with other critical stakeholders, private sector, civil society, so that we can get their input, we can get their buy-in, we can get their validation in terms of how we now roll out the strategy and implement it. Let me mention that this is the first time that we are coming up with a comprehensive strategy for quality health infrastructure in Africa. As a bank, we have been in the health sector since 1975. In fact, between 1975 and 2020, we invested about $5.7 billion in the health sector. $3.7 billion from that came from the bank's resources directly, and we leveraged the additional $2.7 billion, $2 billion. Now, in terms of going forward, we realized that in the late 1990s, as a bank, we were spending around $75 million in the health sector every year, which in today's
billion,
75 million
or million
every year,
right?
In the late 1990s,
right?
Which translates in today's currency to around $300 million if you adjust for inflation.
Right.
And then we realized that we are not doing so much in that sector. And that's why we decided, looking at the pandemic, looking at the call from our governors that we need to invest more in health infrastructure, we decided to put together a strategy for quality health infrastructure where we can scale up our investment in health infrastructure throughout the continent.
Well, obviously, the money that you put in at the outset, I mean, you said you've been investing steadily since the 1970s. I mean, a skeptic would say, well, where's the investment gone? I mean, because, you know, healthcare has not improved in Africa. People would argue that it's worsened on the continent. But you mentioned the private sector. Is there a way that investors could be enticed to invest in healthcare in Africa where such investment could provide good returns and also have a significant impact? For instance, investment in the ICT part of healthcare infrastructure or electricity that you mentioned earlier, etc., which are all linked to healthcare infrastructure.
There are different aspects of health infrastructure, and definitely private investors can come in. What we have seen in our analysis is that there are a lot of investment risk, especially because on the continent you have many poor households that do not have health insurance. That's one. Then two, health financing is very low in many African countries. And so what we are doing, we are opening up our different instruments through which we can also engage with the private sector. What I can tell you is that when you look at the current health financing in health infrastructure on the continent, only 10 to 20% of such health financing on health service delivery infrastructure is coming from the private sector. And so what we are trying to do is to provide what you call all kinds of financial instruments, whether risk-sharing instruments where we can crowd in the private sector to also invest in the sector, or maybe through investment projects themselves, or through result-based financing, or through guarantees, or through equity or debt investments, so that we can attract the private sector in the space. Without the private sector, I don't think Africa can get out of
because I mean,
the doldrum.
It's always very interesting that you know, you hear about how Africa is a great investment opportunity.
Correct.
But then when you look closer, all these other reproaches cancels that out.
Yeah, because, you know, there are many challenges in Africa when it comes to investments. What we see is that private sector, most of them, when they want to invest in the health sector, they go into brownfield health investments, which means, you know, expanding existing hospitals because of the risks associated with investment in the sector. And one of the things we want to do as African Development Bank is that we want to open up more investment in greenfield infrastructure investments. And that's why last year our board approved an equity fund for us to join what we call the Razorite Healthcare Financing Fund based out of South Africa, so that we can work with private sector throughout the continent to really invest in greenfield operations, but also brownfield operations in terms of revitalizing, reviving many of our dilapidated healthcare facilities. Let me tell you something that is very unique in terms of my visit to Nigeria this time around. We met with the Minister of Health of Nigeria, and I really applaud his vision in terms of healthcare for this country, in terms of moving from primary healthcare to super specialty hospitals, and also creating what they call the emergency medical services, as well as the basic health provision fund, which I think is really critical to cater for low-income people in this country so that they can also have access to healthcare services that they need. And that's why we need to work with governments and we need to work with the private sector.
The problem, of course, is that the Ministry of Health, I mean, this particular government has been there, I mean, it's now on its last legs. I mean, it's been there for 8 years. So to have a vision that has not translated into reality for your 8 years in office, what's the point of the vision? I mean, you've spent the entire time, there hasn't been any appreciable difference to the ordinary people in Nigeria of healthcare. I mean, you know, improvements in healthcare, and you're talking about him having a fantastic vision. I mean,
no, I think
how does the vision translate into reality?
I think I have seen some dramatic changes happening. For instance, the Basic Health Provision Fund that the minister talked about has been approved, has been legislated, and is now being rolled out. And in doing that, they are able to cover about 1.2 million Nigerians that are living below poverty line. Yeah. But of course, the challenge is huge. You have about 90 to 100 million Nigerians living below the poverty line.
You don't notice whatever changes are being made. Yeah,
but let's move on. That's a good start for them.
Right. We've got less than 2 minutes before we have to end the chat, unfortunately. You've mentioned some changes, like the one you talked about, that are generating some progress.
Correct.
From the government. But in terms of private investment, are you seeing that? Is there growing interest?
Yes, there is growing interest. I was delighted when we met the CEO of the Nigerian Sovereign Investment Authority and his team. They are investing in diagnostics infrastructure, in cancer centers, but also in new super specialty hospitals. In fact, they have a plan of making an investment about $200 million in a multi-specialty hospitals in this country. And so that for us is very attractive. And we are going to work with them, look into the details of that deal, and see how we come in as African Development Bank. So there is some progress, but we can do more. And that's why we have this strategy.
Well, we applaud you for what you're doing at the bank. Dr. Babatunde Omilola, who's head of the Public Health Division at the African Development Bank Group. Thank you very much indeed.
Thank you, Charles.